Hi everyone, welcome back to Kashi's Corner. We are still discussing about gestational diabetes mellitus in details because of how important it is to the women. If you are pregnant, planning to be, or just curious about how doctors keep both mom and baby healthy, this video is for you. Today, we are diving into a topic that affects millions of women every year: gestational diabetes mellitus, or GDM. How is it diagnosed? When it is screened, and why does it even matter? Let's break it down. Clearly, calmly, no mincing words. What is gestational diabetes? What is gestational diabetes? In a simple English, it is a type of diabetes that develops during pregnancy, typically in the second or the third trimester. It happens when the body can't produce enough insulin to meet the increased demands of pregnancy. That leads to elevated blood sugar levels, which can affect both mother and baby. In most cases, it doesn't show symptoms, which is why screening is crucial. Left unmanaged, GDM can lead to complications like high birth weight, premature birth, or even an increased risk of developing type 2 diabetes later. How is it screened? Now, let's talk about the screening process. This usually happens between 24 and 28 weeks of pregnancy, unless you are high risk, in which case testing may happen earlier. Step 1. Glucose challenge test, GCT. The first test is called the glucose challenge test, or GCT. It's quick and simple. You will drink a super sweet liquid containing 50 grams of glucose. After 1 hour, your blood is drawn to measure how well your body handled that sugar spike. If your blood sugar is below 140 mg, you are likely in the clear. But if it is higher, usually over 130 to 140, depending on your provider, you will need a follow-up test. The diagnostic test. The oral glucose tolerance test, OGTT. This is the gold standard of diagnosing GDM. This one takes longer. You will fast overnight, then have your fasting blood sugar measured. Next, you drink 100-gram glucose solution, and your blood sugar is tested at 1, 2, and 3 hours afterward. Then, diagnostic thresholds. I hope you saw that result. Yes, if 2 or more of those values are elevated, that confirms a diagnosis of gestational diabetes. Yes. Now you might be wondering why it matters. Okay? So why all the fuss about a bit of sugar? Because untreated GDM can lead to serious issues like macrosomia, a baby that is too large, making delivery risky. It also increases the baby's chance of low blood sugar at birth, or even needing NICU care, neonatal intensive care units. Yeah. For moms, GDM raises the risk of high blood pressure, cesarean sections, and developing type 2 diabetes later on. Okay, what happens after diagnosis? If you are diagnosed, don't panic. Most women manage GDM with diets, exercise, and regular blood sugar monitoring. In some cases, insulin or oral medications may be needed. And with proper care, most moms go on to have healthy pregnancies and healthy babies. So to recap, gestational diabetes is common, often silent, but absolutely manageable. If we catch it early, that's why screening is key. If you are pregnant or planning to be, talk to your obstetrics gynecologist about when you will be tested. How do we manage GDM? Managing gestational diabetes is a topic that many moms-to-be never expect. Gestational diabetes mellitus, or GDM. Now you have been diagnosed. What's the next thing? If you have recently found out you have GDM, first of all, breathe. You are not alone. And with the right tools, most women manage it successfully and have healthy pregnancies. Let's walk through everything you need to know, from food to fitness, blood sugar checks to medications. Diet is the foundation. Let's start with the most powerful tool in managing GDM, your diet. It is not about starving yourself or cutting off all carbs. No, you don't need to cut off all carbohydrates. It is about balancing your meals to keep blood sugar stable. A typical gestational diabetes meal includes lean proteins like chicken, non-starchy vegetables like spinach, broccoli, or peppers, whole grains or complex carbs like quinoa or brown rice, healthy fats like avocado or olive oil. Just focus on low glycemic index foods. These don't spike your sugar as fast, and don't skip meals. Eating every 2 to 3 hours, including 3 meals and 2 to 3 snacks, helps keep your blood sugar steady. Next is blood sugar monitoring. Yeah, that little finger prick. Most women with GDM check their blood sugar 4 times a day. Once fasting in the morning, and then 1 or 2 hours after each meal. Your doctor will give you target numbers, but here are some general goals. Keep a log or use an app to track your readings. Some glucometers even synchronize with phone. Exercise is your ally. Here is a secret weapon in your GDM toolkit. Movement. Move your body. Exercise helps your body use insulin better, meaning lower blood sugar naturally. You don't need to hit the gym. Walking for 15 to 30 minutes after meals can make a big difference. Prenatal yoga, swimming, or gentle workouts are also great options. Just be sure to get the okay from your provider first. Although sometimes, even with the best diet and exercise, blood sugar levels stay elevated, and that's okay. It doesn't mean you failed. It just means your body needs extra support. your provider or doctor might recommend insulin, which is completely safe in pregnancy, or in some cases, oral medications like metformin. These don't hurt the baby and helps reduce complications when used appropriately. Monitoring your baby's health. This is very crucial. As a GDM mom, if you have GDM, your care team will probably keep a closer eye on your baby, especially in the third trimester. You might have extra ultrasounds to monitor baby's growth and sometimes non-stress tests to check how baby is doing. Some moms are induced early, especially if the baby is large or there are other risks, but every case is different. Life after delivery. Here is the good news. GDM usually goes away after delivery, but it does raise your future risk of type 2 diabetes and babies too. That's why your doctor will recommend a glucose test a few weeks after birth and a regular check after that. Staying active, eating well, and maintaining a healthy weight can lower your long-term risk. Managing gestational diabetes might feel overwhelming at first, but trust me, you got this. With the right info, a bit of structure, and a great care team, you can take control and protect your health and your babies. Which part of GDM management feels hardest for you? Answer this in the comments. If you found this video helpful, give it a thumbs up, share it with a mama-to-be, and don't forget to subscribe for more. Until next time, take care of yourself and the little life growing inside.